Shadow Secretary of State, Jonathan Ashworth.
Deputy Speaker, and I move the amendment that stands in the name of the Leader of the Opposition. Myself. Well, I mean, the Secretary of State talked a lot, but didn't say very much, Madam Deputy Speaker, with that. I mean, look at the context in where we are. Yesterday, we recorded 36,000 COVID infections. Hospital admissions have increased to over 500 a day, up 50% in a week. Waiting lists are at the highest level seen on record, currently at 5.3 million. 336,733 people have been waiting over a year for treatment. Over 76,583 people are waiting over 18 months. And over 7,000 people are waiting over 2 years. 25,889 people are waiting more than 2 weeks from urgent referral to a first consultant appointment for cancer. Emergency care is grappling with some of the highest summer demands ever seen. 250,000 people are waiting for social care. NHS staff are exhausted, facing burnout. We went into this pandemic with 100,000 vacancies across the NHS and a further 112,000 vacancies across social care. And the answer from the Secretary of the State is to embark on a top-down reorganisation when we are not even through the pandemic. A reorganisation that won't deliver the integration needed because reforms to social care are delayed again. A reorganisation that won't deliver more care because, in fact, in periods of stretched health funding, could well deliver less care. And a reorganisation that is, in effect, a Trojan horse to hide a power grab by the Secretary of State. And let's be clear why this reorganisation is taking place. The reason they've come forward with this bill is because of the mess of the last reorganisation, the mess that he supported and voted for, the mess that he spoke out for in this House, saying it would modernise the NHS, and the concept of GP commissioning has been widely supported from politicians of all parties for many years. I urge my right honourable friend to keep putting patients first by increasing GP involvement in the NHS. Why, if he believed that then, has he U-turned now? And it was a mess that we warned of. My honourable friend, the member for Leicester West, who opposed the bill in this House, warned the government that it would increase bureaucracy, warned the government that it would increase the fragmentation that he's just complained about from the dispatch box. And when ministers said that reorganisation under Lord Lansley would reduce bureaucracy, and when backbenchers told us it would reduce bureaucracy, what ended up with that reorganisation? Billions was wasted, thousands of NHS staff were made redundant, and that was their priority then. And now they're asking us to clean up their mess today. They also told us that reorganisation would improve cancer survival rates. And where are we today on cancer survival rates? We are still lagging behind other countries on cancer survival rates. So perhaps the Secretary of State could have come to the dispatch box and apologised for that Lansley reorganisation and apologised for 10 wasted years. Now, we talked about NHS leaders, but the truth is NHS leaders asked for a simple bill to get rid of the worst of that Lansley restructuring and instead to re-embed a sense of equity, collaboration and social justice in our NHS structures. That is not what this bill is. And of course, the Secretary of State secretly agrees with me, because according to the Times, he wrote to the Prime Minister saying there were significant areas of contention that were yet to be resolved with this bill, and he wanted to delay it. Well, of course, the Secretary of State was only back 5 minutes, and already Downing Street was overruling him. But of course, on this occasion, when they overrule him on his choice of spin doctors, he walks. When they overrule him on the future of the NHS, he puts his career first and stays in the Cabinet. Now I listened carefully to the case made by the Secretary of State, and he talked of the need for greater integration between health and social care, about the need to provide better coordinated care. He referred to an ageing population. And to be frank, that was a speech that health secretaries and their predecessor social services secretaries have been making more or less since 1968, when Richard Crossman first proposed the first set of NHS reorganisations. And indeed, there were echoes of his speech in that made by his predecessor, Keith Joseph, when he came to this House in 1972 to set up the area health authorities, bringing together hospitals and community care, working more closely with local authorities because we needed seamless care. And those authorities were of such a size that within a year they were rearranged again into district health authorities. Well, given the size of some of these integrated care systems that he is proposing, I suspect the seeds of the next reorganisation are being sown today. Now, yesterday, he told the House that his three pressing priorities for these critical months were getting us out of the pandemic, busting the backlog for non-COVID care, and putting social care on a sustainable footing for the future. But absent in his speech was any credible explanation as to how this reorganisation will meet his own objectives that he outlined to the House yesterday. And in fact, in the last 30 years, we've seen around 20 reorganisations of the NHS. Have any of them delivered the outcomes that health secretaries have promised from the dispatch box? Well, not according to analysis in the British Medical Journal, who observes past reorganisations have delivered little benefit. So why should this one be any different? So the question for me, how will the 85-year-old with multiple care needs experience better whole-person care as a result of the restructuring he is embarking upon? How will waiting times for elective surgery, for cancer and for mental health be improved by this reorganisation? How will health inequalities that have widened and life expectancy advances that have stalled be corrected by this reorganisation? On those questions, the Secretary of State had no answer today, because the bill fails those tests, because it is a badly drafted bill and in fact could even worsen health outcomes. Let me outline our specific concerns. First, on the proposed integrated care boards. The bill collapses the remaining 100 or so clinical commissioning groups into 32 integrated care systems, differing in geographical size and some covering populations up to 3 or 4 million. And in some parts of the country, the ICSs are not based on the NHS agreed boundaries, but currently centrally drawn up boundaries for political reasons. We know that Cheshire will be combined with Merseyside. Glossop is cut off from Greater Manchester and allocated to Derbyshire. Frimley is split up, leading the former Prime Minister, the Right Honourable Member for Maidenhead, in an adjournment debate recently to complain, "Do not break up Frimley ICS. Just for once," her words, "just for once, let common sense prevail." So these boundaries and the way in which they were proposed by the previous Secretary of State prompted NHS providers to warn that the disruption could lead to a worsening of patient care. That was their words. Then, of course, we have the design of the integrated care system, split across 2 committees, a partnership board containing people from local authorities, the third sector and others, and an NHS board responsible for spending the money, commissioning. Remember, he's moved away from GP commissioning, of course. He wants the NHS board to commission now. Those 2 boards will probably have different chairs, but the NHS board only has to have regard to the partnership board strategy. Nor is it clear how local authority seats, the one local authority seat, will be decided when they cover more than one council, possibly even councils of different political persuasions, so we'll see how consensus can be built then. And other important voices are left out. Mental illness, Madam Deputy Speaker, accounts for roughly a quarter of the total burden of illness, yet there is no guarantee that mental health providers will get the seats on these boards when we know that mental health service is under pressure, and he tells us that mental health backlog is one of his personal priorities. And the pandemic has also reminded us that the health and well-being of our community is not just in the hands of large hospitals or general practice, it's also in the hands of our directors of public health, who have shown exceptional local leadership throughout this crisis, standing on the shoulders of their forebears who confronted in the past diseases like cholera, smallpox and diphtheria. Test and trace would have been far safer in their hands from the outset, by the way, Madam Deputy Speaker. And what is their reward? They are sidelined. Public health, again, should be properly represented on the NHS boards, and we'll be moving amendments to that effect. I will do.
It's not just about them being sidelined, but it's actually about the budgets to public health, which have been pushed off into the autumn. If the consultation paper that we went out last year is aimed to go by, County Durham would actually lose 19% of its budget. So how can we actually be taking these changes without being divorced from what's actually going to be provided in terms of cash?
Honourable friend is absolutely right. I'll come to the financial flows in a few moments. But how on earth can we have a triple aim of trying to improve health outcomes for a population and not even giving public health a voice and a seat on the decision-making body that decides health plans for an area? So, equally, he talks about integrating health and social care. There's no seat for directors of adult social services on these committees either. And what about patients? Patients wasn't mentioned very often in the Secretary of State's speech. Patients will always come first for us on this side of the House. And they have no mandated institutional representation either. No guaranteed patient voice. So we have yet again another reorganisation of the NHS where patients are treated like ghosts in the machine. It's utterly unacceptable, Madam Deputy Speaker. This is fragmentation, not integration, and with a continued sidelining of social care. And there is a loss of local accountability as well, because there is no explicit requirement that these boards meet in public or publish their board papers. NHS England has stated that is their preference, but it is not required, nor is there any commitment, given the wider geographical spread of some of these ICSs, for meetings to be accessible online. But of course, the white paper did indicate that the independent sector could have a seat on an ICS, and the explanatory notes to the bill say that local areas will have the flexibility to determine any further representation. And of course I will. And then I will...
Will he come to his... He talks about solutions to social care. Will he come to his own solutions to social care? And will they potentially include the recommendations of the select committees in terms of that German-style social care premium? Recommendations that were made by members on that committee of his party, that were elected by his party to serve on those committees. Is it something now he's willing to explore? Because he's ruled it out time and time again on the floor of this House.
I have... The honourable gentleman is a dogged advocate for this proposal for social care, and he's quite right. He always raises it with me. I'm unpersuaded, but I'm more than happy to sit down with the Secretary of State to discuss, with my honourable friend from Leicester West, to discuss a solution to social care. We keep getting told that they're going to have cross-party talks. Well, as I say, I think I missed the Zoom link because they haven't happened so far, Madam Deputy Speaker. Now, these committees do permit a seat, if the committees want it, for the independent sector. And we've seen in Bath and Somerset, Virgin Care get a seat on the shadow ICS. We think that is unacceptable, and we will be moving amendments to prohibit it in committee. Now, I do welcome the removal of Section 75 competition and procurement rules, finally scraping off the remnants of the Lansley competition rules off the boots of the NHS. Because we did warn him and others that this competitive compulsory tendering would lead to billions going to the private sector, would be wasteful and bureaucratic, it would be distracting, and it even led to the NHS getting sued by Virgin Care when they didn't win a contract. But this isn't the end of contracting with the private sector, because without clauses to make the NHS the default provider, it would be possible for integrated care boards to award and extend contracts for healthcare services of unlimited value without advertising, including to private companies. And given the past year, when huge multi-billion-pound contracts have been handed out for duff PPE and testing, we naturally have concerns about that and will be seeking safeguards in committee. We are worried about further cronyism. But the reason why we are particularly concerned with this bill is the power grab clauses for the Secretary of State. He is creating 138 new powers, including 7 allowing him to effectively rewrite the law in future through secondary legislation to transfer functions between its arm's-length bodies without any proper scrutiny. And he has not explained why he needs these powers or given any guidance on how he expects to use them. And these powers also include a requirement that ministers are informed of every single service change, of every single reconfiguration, and the Secretary of State will then decide whether or not to call them in for ministerial decision. Are you sure you want that power, Secretary of State? Now, because the Secretary of State has gone from wanting to liberate the NHS under Lansley to now listening out for the clang of every dropped bedpan echoing through Whitehall. This is not a plan for service modernisation. It's a back-to-the-future plan and will mean more inertia. Instead of powers to interfere at every level, we're resetting the mandate within years for the NHS. We instead would want the duties on both the Health Secretary and therefore the 42 ICSs to which he delegates those responsibilities, the duties to continue the promotion in England of a comprehensive health service as per the 2006 Act to be fully reinstated and made explicit. And that will be my final intervention, because I know there's a lot who want to get in.
As ever, I listen to him carefully. If it is the Back to the Future bill, then it presumably puts right what once went wrong. Does the right honourable gentleman support the clauses around foods high in fat and salt and sugar and the watershed proposals around advertising?
Yes, and I'm disappointed that they're in this particular bill, because I think they should be a standalone bill. And I'm going to, in my concluding remarks when I get to it, just say a remark or two about other public health interventions, which I imagine he, as a great champion of public health, would support, I would hope. It's crucial that the Secretary of State's duty to provide comprehensive health care is reinstated, rather than this duty to meddle in the NHS at any time he wants, because there is lack of clarity about how the funding flows work in this system. The talk is of moving to capitated budgets for an area in order to provide holistic care to meet the complicated care needs of individuals. But when you've got waiting lists increasing at the rate that they are increasing by, when you've got cancer rates going up, and mental health referrals going up, how is an area going to fund the episodic care for each unit of extra care that is needed? Often care which is expensive and more complicated because it needs to be done in the acute sector. And we have worries because the clauses in the bill around the financial duties on ICS boards, NHS trusts and NHS foundation trusts, clauses 21 to 24, are alarming because they place a duty to ensure financial balance across the ICS area, but with no clarification about how that balance should be achieved and enforced. So when we know that local health budgets have been stretched to breaking point after years of underfunding, what does this duty mean for existing deficits? At the moment, trusts have a combined deficit of 910 million. King's has a deficit of 111 million. Worcestershire has a deficit of 81 million. Leicester University Hospitals Trust has a deficit of 80 million. So will the ICBs need to fill this £900 million black hole before they are even up and running? And going forward, how exactly will a trust and an ICS board, how exactly will trust and ICS board deficits be dealt with at the end of each financial year? Because he may recall, or some in the House may recall, that this could well be a return to the days, like we saw in the 80s, when health authorities would close beds and put off paying bills from January onwards in order to hit financial balance. Or will it result, if they've got to hit this financial balance year by year, will it result in a postcode lottery of more rationing and an even longer list of treatments being effectively removed from the NHS by decisions of ICBs because they've got to hit balance, effectively forcing patients to either go private or go without? I hope the Minister, in summing up, can clarify what the situation will be. And if a set of providers, trusts and an ICB, feel that the financial settlement that they have been given by NHS England will not allow them to deliver the levels of care to bring down the waiting list that he said is one of his top priorities, to improve mental health outcomes that he said is one of his top priorities, what is their appeal process? Because at the moment, by splitting out NHS England and by bringing them together and not splitting them out, how will the arbitration process work on whether on an area's financial settlement. Now, Madam Deputy Speaker, the bill is spun as an attempt to integrate health and social care, but there is nothing in it to actually integrate health and social care because there's nothing in it to fix social care. And if this was about integrating health and social care, where is the long-promised bill to reform social care? But the bill does repeal Care Act legislation that requires patients to be assessed for their social care needs before being discharged from hospital. But without long-term funding in place, this could mean a patient sent home, left without support, waiting for an assessment. So can the Secretary of State, or the Minister summing up, guarantee that this will not be the case? And will they put in place the necessary funding alongside the bill? Now, a number of Royal Colleges and health bodies have said today that the biggest challenge facing the NHS is workforce. We agree. Now, the bill proposes a duty on the Secretary of State to report on workforce once every 5 years. That is simply not good enough. We need a solution to workforce now. We need a solution to recruitment now. Our staff need a fair pay rise now, and we need more investment in training and professional development budgets now, and we need safe staffing legislation now. So we will be looking to amend this bill, hopefully on a cross-party basis, perhaps working with others who have put forward their own proposals to improve the workforce sections of this bill. And what does the bill mean for agenda for change, as my honourable friend from York put to the Secretary of State? Because the bill at the moment suggests that an integrated care system can change agenda for change terms. We disagree with that. And finally, on public health. The bill introduces restrictions on advertising of less healthy food and drink. We welcome this step. That was also in our 2017 manifesto, which he's been reading, which he may have noticed. But we would go further. So why is it that we cannot have more restrictions around the advertising of unhealthy food around schools? And of course, our public health crisis isn't just about obesity, it's also about smoking and alcohol. So why aren't there provisions on smoking, on smoking services in this? Why aren't there provisions to ensure labelling of calories on alcohol in this bill? We will be seeking amendments in committee on that as well. But in conclusion, Madam Deputy Speaker, this is the wrong bill at the wrong time. Will a person with learning difficulties or an older person experiencing who needs social care experience improved care? No. Will social care be brought back in from the wilderness? No. Will the cancer backlog be tackled more effectively? No. Will health inequalities be narrowed? No. Will parity of esteem for mental health be delivered? No. Instead of a simple bill to end competition and foster local collaboration, NHS staff will be left with trying to second-guess where the Secretary of State will interfere next in the safe running of their local NHS with his in-year changing mandate. And where the rules around funding could result in more rationing and cutbacks, we cannot possibly support this bill. Madam Deputy Speaker, we have championed integrated care for many years, but this bill does not deliver it, and we urge the House to accept our reasoned amendment tonight.